Hi! Okay, so if you are here, it's because you probably feel like your hips are a bit stuck, or maybe you feel like one leg is slightly longer than the other, or you're just a bit uncomfortable around the pelvis. So what we're going to do today is a typical SI joint release. It's something you could do realistically every day or every other day to just make sure that that pelvis doesn't get stuck or feel kind of pinchy and a bit gritty. So I'm going to find your way onto your back. You don't need anything with you. Just find your way down onto your back. Bring the knees in towards the chest. So we're going to use what's called a PNF stretch, which is a active stretch as opposed to a passive stretch. So you are going to start by bringing the fingers interlaced over the knees, and then what we're trying to do is we're thinking about pushing the knees towards the ceiling at about a 5, maybe 6 out of 10. We're not going full throttle, but we're not going easy. And then you want to similarly imagine that your hands are pulling the knees back down towards the floor. So you're pushing and pulling. So when you're ready, we're going to do this for 15, release for 10, go again. So, sorry, other way around. Push for 10, release for 15. Push the knees up towards the ceiling, pull the hands down for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Release, squeeze them in. And then again, when you're ready, push and pull. Ready, 4, 3, 2, 1. Go again, push and pull. 7, 6, 5, 4, 3, 2, 1. Release the tension. We're going to do it one more time. We're going to do each of these exercises in 3. So one more time. When you're ready, push and pull. 3, 2, 1. Release the tension. Okay, so we're going to start with the right leg. I want you to send your left leg all the way down onto the floor. If this feels too intense, by all means grab a cushion, bring it underneath the knee so that it's supported, but we don't really just want it kind of hanging in a bent position. So you're going to squeeze the right knee again towards the chest. Notice if it wants to weave out towards the armpit. Try and keep it directly forward over the chest. Notice if the chin tries to escape, it's because it's resisting this stretch, so tuck the chin back down. Okay, so again, push and pull. You may feel the pinching in the inner thigh, that's okay. Release the tension. Get ready, push and pull. Release the tension. One more time. Release the tension. Okay, so left hand is going to come to the outside of the right knee. You can move the right arm anywhere you feel comfortable. You're going to hook your right foot behind the left thigh. Don't place it on the top, don't let it slip over, it's got to be hooked. And then draw the right knee over. If you're super bendy and this feels okay for you, don't. Keep the knee at the same height as the bottom leg. Okay, so same again, push up, pull the hand down. Five, 4, 3, 2, 1. Release the tension. All the way, let the glutes soften on both sides. And again, push up, pull down. Release, release, release. Last time, push and pull. Release, release, release. Roll onto your back, swap sides. So left knee comes in, right leg goes down. Again, support if you need to, if it pulls on the low back. Hug the knee in, make sure it's not winging, pull it in. Same again, when you're ready, push and pull. Release, release, release. And again, push and pull. Release, release, release. One more time, push and pull. Release. Okay, so time to swap sides. So hook the foot underneath. Same again, hand comes on the top. This arm, if you want to incorporate a chest stretch, by all means open the arm out. If you don't, bring the hand down. Hook the foot, draw the knee over, make sure you're not flopping. Keep it active here. Hip ideally wants to be pointing towards the ceiling. Knee in line with the bottom leg. And again, push up, pull down. Really. And again, push up, pull down. Really. Last time, push up, pull down. And release. And slowly find your way into your back. Plant the feet down. Bring them about mat width distance apart, hands by your side, and just gently drop them slightly from side to side. Don't collapse them all the way. You just want to let go of any tension you might be having in the low back. And slowly roll onto one side and push yourself up to a seat. And that's it. If you feel any popping sensation during that, that's not a bad thing, that's a good thing. If you don't feel any popping, that's also absolutely fine. It may be that the bone doesn't need to just crack and release, it might be more of a muscular tension. So either way, you'll be helping to just unstick that hip joint and give it a bit more mobility. I hope this helps.